So hi everybody, please welcome to another J9's Patio Chat Check-In. This will in fact be number 365 and it's being pre-recorded and in fact on International Women's Day. So I do want to send a special shout out to all the strong and wonderful women in my life. I'm very pleased to have Dr. Robert Strang with me today, our Chief Medical Officer of Health here in Nova Scotia. I want people to know, Rob, that I do know you so they won't think it's weird when I call you Rob.
It's fine.
I hope that's okay.
Absolutely okay.
Yeah, so thank you again so much for joining me. What I wanted to talk about a little bit today is sort of where we are now with COVID and some of the positive things we've seen as a result of COVID, because I know you talk a lot about that, and I do too, about some of the silver linings, or we will look for the good in things. So first of all, I do want to thank you on behalf of Nova Scotians and I'm sure Canadians and others for your tremendous leadership and response to the public health response to COVID-19 in our province. And I know, of course, you influence the rest of the country as well. So we are recording this, pre-recording this, but when this will air, it will be March 16th. Here in Nova Scotia on March 15th, 2020 was the first time that we saw COVID-19 in Nova Scotia. And at the time, the language being used was presumptive cases. So on that day, we had three individuals. And something you may not know, Rob, I try really hard not to say cases. I always try to say individuals testing positive with COVID-19. It's part of my pushing the language, positive language, so that we always think of people as individuals. Anytime somebody tests positive for a case, like there's a case, that's an individual, that's somebody's family member. So you will hear me talk that way. And I know I just checked before connecting with you, and I see that we don't have any individuals that are being reported today testing positive for COVID. And of course, the testing is not in real time, so we know those tests are from previous days. But if we look back, I guess, at all that, are we where you thought we would be now, or did you even have a sense a year ago today where we might be at this time?
I did not. I don't think anybody who's truthful would say that they did. I mean, we have not had an event like this for 100 years. We had H1N1 and SARS, but they were so very, very different, and they were mostly health system events. This is a societal-wide event, all parts of government and all levels of government and all society. And the last time we've been in this for an infectious disease would have been in 1918, 1919. But that society is so much different today that, you know, there's a few things you can learn from the pandemic influenza in 100 years ago, but not a lot. So most of this is entirely new, and not just in Canada, but around the world. You know, we could make some assumptions, but really knowing how it was actually going to play out, nobody really knew. So other than, you know, at a very, very high level, that based on previous pandemics, we might get multiple waves. Yeah, the basic public measures, health measures we're going to have to use, which is really interesting, haven't changed in 100 years. It shows you that some, really good basic public health works. And then that we knew that there would be some role for a vaccine at some point, but I don't think anybody would have predicted how fast we were able to develop multiple vaccines with a lot of promise that we have right now.
Yeah, that's I agree. And actually that kind of segues nicely into the second thing I wanted to talk about. So in terms of silver linings and good things, so we know COVID-19, it's as Dr. Barrett Lisa likes to say, a stealth virus, very unpredictable. And we hear a lot about COVID fatigue now, and I know people are tired, but I also think there have been a lot of positive silver linings that have come out of COVID-19. And one that I'll share with you for me is that my family, I think my family is in Cape Breton, so that's where I'm from. And after we got out of lockdown last year, so after that first time, I went to live with my family in Cape Breton and work from there for a little bit. And that was really a wonderful experience. And over the year, I've been able to spend, I would say, more time with my family than I ever have. It's not the way I would have chosen it necessarily, but to me, it's been a big silver lining. So I'm wondering for you, do you have any silver linings that you think COVID has brought us?
Well, there's a number of things that I think, as we were talking just before we started to film, is that I like to talk about, there's a couple of phrases. People would say, never waste the opportunity of a crisis, because you always learn something from it, right? And as hard as it is, and I by no means want to diminish at all the impact of the deaths that have happened around the world and even very close to home, but also the impact of the necessary public health restrictions, what it's taking to control COVID, has its own set of very substantive impacts on people's isolation, mental health, substance use. People, some in parts of the economy have been absolutely devastated, people out of work. But how do we learn from that? And I think there's a lot of people that are saying that, they were forced to reconnect with family and live simpler lives, find out what was really important in their lives. And maybe there's lessons there about how busy we collectively make ourselves as families as we come out of COVID, and maybe leave some things behind. I think there's lessons around that are also applied. Some of this, I've been reading some things about, we would face things like this with climate change anyway. The need to shift to virtual work, the need to rebuild our economy, but now from a very green lens. There's important pieces there that we can say, well, maybe this is helping us to deal better with climate change, because we've been forced to make some very difficult choices. Things like, as hard as it is, the global travel and tourism and business travel on that was going to come under a crunch anyway because of climate change and stuff. So it's maybe just fast track some of those really important, challenging conversations that you don't get to unless you're forced to. So though I see those opportunities, I think there's a real opportunity in Nova Scotia. We've successfully, I think, built our response a lot on how do we look after each other? How do we care for each other? Perhaps putting each other and the health of our communities first ahead of ourselves. So I'm really curious to say, how do we sustain that piece to build more caring communities in our approach post-COVID? That we recognize each other in our communities, and everybody's got certain challenges we just need to support each other with. And the last piece is COVID has clearly highlighted some very fundamental inequities in our society. We knew they were there before, but it's highlighted them. And you say, it's International Women's Day when we're filming this. Well, many of the people in the service sector who all of a sudden are very valuable, whether they're grocery store workers, they're cleaners, many of them are women, many of them are immigrants or some of our marginalized populations. So we fundamentally, I believe, we've been given an opportunity to rebuild, if you will, post-COVID with an equity lens. And make things much fairer with a greater sense of justice and a more equitable sharing of resources as we try to come out of COVID. So those are all the opportunities. None of them are easy, but I think if we're going to take something from COVID and we're definitely going to be different, but how do we be better while we are different at the same time? And that's what COVID gives us, the chance to do that.
Yeah, I agree. And I know Dr. Tam would love to hear you talking about the equity lens, because I know that's a big part of the report she put out around COVID-19 and making sure that we could be, it's an excellent opportunity to be more equitable, and hopefully we'll see that. And you mentioned vaccines, and I know, again, I was saying people are getting tired, but I think people are also very hopeful because we now have vaccines approved in Canada. I know that the Nova Scotia vaccine plan has been released, and so people are anxiously awaiting vaccination, and some people have already been vaccinated. So I'm just going to give you like the last word before I wrap up, and just ask you if there's anything you want to tell folks or share with folks, sort of as a words of wisdom or kind of looking ahead. So we've been in it for almost a year, but is there anything you want to share?
So thanks. I mean, vaccines do give us hope. And certainly we know that that this is how we get out of COVID, in a manner that builds population immunity without having large numbers of people getting sick and all the impacts at an individual and a health system level that would happen from people getting ill. However, while we say this gives us hope, I just need people to try to hear that, this doesn't happen overnight.
Mhm.
Two things, that to immunize 1 million Nova Scotians or all Canadians takes time and will take several months to do that. Things are looking a bit rosier with some of the recent changes, and we can get people first dose sooner, but they still are going to have to get the second dose. So it's going to be into the fall before we get everybody the chance to get fully immunized. So we do need people's patience. It's going to take time. And the other thing is, until we get that full immunity, we're going to have to live with some levels of COVID protocols in our own lives, as well as potentially some level of restrictions as there's fluctuations in virus activity. So it's hope, but also the ask for people to be patient. We're going to have to live with COVID for a number of months until we get everybody fully immunized, and that will take a bit of time. So just tempering some expectations around the timelines for all of this is really important. But once your opportunity comes up, in Nova Scotia, based on age, to get immunized, and that's the way we, not just for ourselves, but to keeping everybody else around us safe. Following what we've done all along is by taking actions ourselves to protect everybody else.
Right. Well, I can tell you, I will definitely get vaccinated when it's my turn. I'm very happy to wait, though. I think we have a good plan, and I think it's very important that the populations that need it most get vaccinated first. So I appreciate that. And I do want to thank you so much again for taking a few minutes to talk to me today. It was really great to have you here on the patio chat. I didn't do it on the patio because it's a little unpredictable with the sound. So if you watch my patio chats regularly, I try to do them on the patio, but today I didn't want to take that risk, even though it is a beautiful sunny day here in Halifax. So I'm just going to wrap us up. And I told you beforehand, I have a little tagline I share. Take good care of yourselves, take good care of others, and I'll see everybody tomorrow. Bye.
Thanks. Bye.